Have you noticed someone you love acting a little different lately? Maybe a tiny change here or there that just doesn't feel right. What if I told you these small changes might actually be quiet warnings from their body, months before their final goodbye? Don't ignore these signs. Knowing them can help you give the love and care they truly deserve. Many people believe that when an elderly person passes away, it happens suddenly, like out of nowhere. But the truth is, the body often whispers clues for many months before. The problem is, these signs look small and easy to miss at first. Families often only realize what was happening when it's too late to prepare or to make those last days special. In this video, I will share 5 important signs that usually appear about a year before an elderly loved one passes away. Some signs might seem like normal aging, but they are actually the body's way of slowly shutting down. If you recognize these signs early, you can provide better care, create meaningful memories, and most importantly, help your loved one live with comfort, dignity, and peace in their final days. Stay with me until the end, because understanding these signs will prepare you emotionally and practically, so you are never caught off guard. You'll be able to cherish every moment with unintentional weight loss. Maybe you notice their belt feels looser, or their clothes hang a bit baggy, or maybe they don't seem as hungry as before. Many families think this is just a normal part of aging, but when weight drops without trying, it's rarely a good sign. It usually means the body is not absorbing nutrients well. Muscles start to shrink and important body functions slow down. Some muscle loss is normal with age, but if it happens quickly, it points to something deeper going on. Their body might struggle to digest food or process proteins, causing muscles to waste away. Losing strength doesn't just make walking or standing harder. It also raises the risk of falls, weakens the immune system, and makes them more vulnerable to infections. Another reason for weight loss is loss of appetite. As people age, their sense of taste and smell can dull. Food doesn't seem as appealing, and they may skip meals or eat less. This isn't just a preference. It's a real physical change. The body starts signaling less often for food because it's preparing for bigger changes ahead. Sometimes, serious health issues like cancer, heart problems, or kidney disease cause weight loss long before other symptoms appear. Even depression or memory issues can make eating difficult, creating a cycle where the body doesn't get enough fuel to stay strong. Families often try to help by offering favorite foods or protein shakes, but if weight keeps dropping despite these efforts, it means the problem isn't just about eating. The body is slowly shutting down. Forcing big meals might not help and can even cause discomfort. Instead, focus on comfort, soft, easy-to-eat foods, and plenty of fluids to keep their quality of life good. If you notice serious weight loss combined with weakness or difficulty staying active, it's time to pay close attention. This isn't just about looks. It's the body sending a clear message. Knowing this now helps you prepare with love, kindness, and making each moment count. Have you noticed your loved one getting tired in a way that rest just can't fix? This isn't the usual tiredness after a busy day. It's a deep, heavy exhaustion that makes even the smallest tasks feel like climbing a mountain. Getting out of bed, walking across a room, or even talking can drain all their energy. This kind of tiredness isn't just normal aging. It's the body saving what little energy it has left. As the organs slow down, the body focuses on what's most important, keeping the heart beating, the lungs working, and the brain alert. Because of this, muscles get less oxygen and strength fades. Their metabolism slows too. Instead of using energy for moving around, the body conserves it. That's why they may sleep more or suddenly feel wiped out without warning. One minute they seem okay, and the next completely exhausted. For seniors who have always been independent, this can be very hard. They may feel frustrated or embarrassed that they can't do what they once did. They might avoid talking or spending time with others, not because they don't care, but simply because they have no energy left. This can lead to loneliness and sadness. For families, it's painful to see this change. Sometimes people think their loved ones are just being lazy or not trying hard enough, but that's not true. The best way to help is to know their limits, let them rest, and make sure their last days are peaceful and comfortable. If your loved one feels tired all the time, even after resting, take it as an important sign that their body is changing. This is a time to enjoy quiet moments together, share gentle talks, and support them with love, no pressure needed. Because in the end, what matters most is that they feel loved, understood, and calm. Have you noticed your loved one getting forgetful or confused lately? Maybe they forget names, repeat themselves, or get lost in familiar places. These changes can be hard to see, but are often signs that the brain is preparing for the final stage of life. This confusion is not the usual forgetfulness we all have sometimes. As the body slows down, the brain gets less oxygen and nutrients, which affects memory and thinking. The person might have good moments where they seem clear, then suddenly feel confused again, like a light flickering on and off. They might also start to pull away from social activities. You may see them speaking less, avoiding visitors, or sitting quietly alone for long times. This is not because they don't care or want to be alone. Their brain is just processing emotions and interactions differently now. Loud places or long conversations can be tiring, so they retreat into a calmer, quieter space. Mood changes are common too. Some become anxious or irritable, while others seem peaceful but distant. These are not personality changes, but signs of the brain adjusting to the body's decline. For families, this can be very painful. It can feel like losing your loved one even before they are gone. But remember, they can't control these changes. Instead of forcing talk or activity, be gentle, offer comfort, and simply be present. Even when words fail, your love and calm presence mean everything. If you see increased confusion or withdrawal, don't ignore it. These are often early signals that the final transition is approaching. Use this time for patience, quiet moments, and creating a safe, loving space where they feel cared for and peaceful. Have you noticed that your loved one, who used to rarely get sick, now seems to catch every cold or infection going around? Or maybe small cuts and bruises just don't heal like they used to. This is a very important sign that their body's defense system, the immune system, is getting weaker. When the body slows down, it can't fight off germs as well as before. Infections like pneumonia, urinary tract infections, skin infections, or mouth sores become more common. Families often think these are just one-time illnesses, but if they happen again and again or take a long time to heal, it usually means the body is losing its strength. Even medicines like antibiotics that used to work quickly may not work as well anymore. It might take longer rest, stronger medicine, or several treatments to get better. This happens because blood flows slower and organs don't work as strongly as before, so healing takes more time. Another problem is wounds that just won't heal. Small scratches, sores, or bruises that keep opening or don't get better can mean poor blood flow. When blood can't carry enough oxygen and nutrients, healing slows. For people who move less, pressure sores, painful areas on the skin, can develop and lead to serious infections if not cared for carefully. What's even harder is that infections in the last months may not show usual signs like high fever. Instead, your loved one might seem more tired, confused, or lose their appetite. Sometimes, sudden confusion or sleepiness is the first sign that something isn't right, even before other symptoms appear. This is why paying attention to these changes early can make a big difference. It helps you get the right care and makes your loved one more comfortable in their final days. For families, watching a loved one face repeated infections can be very hard and frustrating. It's natural to want to try every treatment, hoping that one more round of medicine or one more hospital visit will help. But at some point, the focus shifts from curing to comforting, making sure your loved one stays hydrated, keeping their skin clean and soft, and reducing stress on their body can bring more comfort than another medicine that might only prolong suffering. If you're still with me and finding this helpful, please comment number 4 below so I know you're here. And if you haven't subscribed yet, please subscribe and turn on the notification bell. Your support helps us keep making videos that inform and inspire you. Now, let's move on to number 5. One of the clearest signs that the body is preparing for its final stage is noticeable changes in breathing and blood flow. You might notice your loved one breathing more slowly or more shallowly than before. Sometimes their breaths pause between, or their breathing speeds up and then slows down unexpectedly. Some people show a pattern called Cheyne-Stokes breathing, where breathing cycles between deep, fast breaths and long pauses. These changes may start small, but become more obvious over time. Another sign is weaker circulation. Their hands, feet, nose, or ears may feel cold when you touch them. Their skin might look pale, bluish, or blotchy, especially on fingers and toes. This happens because the body sends blood mainly to vital organs like the heart and brain, cutting off flow to the outer parts. It shows the heart isn't pumping as strongly as before. Sometimes just sitting up talking or moving a little can leave them short of breath. They may breathe more through their mouth or need to stop and catch their breath. If they used to walk easily but now struggle, their lungs may be getting weaker. Fluid can also build up in the lungs, making breathing difficult. This can cause coughing, gurgling sounds, or tightness in the chest. Many think it's just a cold, but for elderly people near the end, it often means the lungs are struggling. Lying flat might feel uncomfortable, so they may sleep with extra pillows or sit in a recliner to breathe easier. For families, seeing these breathing changes can be scary. It's normal to want to help by encouraging deeper breaths or worrying that something urgent is wrong. But often, this is just the body naturally slowing down. There might not be a way to stop or reverse these changes, but you can help by keeping the room cool, using humidifier, and offering small sips of water. Sometimes medicines or oxygen help, but the main focus is on comfort, not fixing the problem. If you notice uneven breathing, cold hands or feet, or bluish skin, pay close attention. These signs mean the body is saving energy and circulation is slowing. This is a time to be present, offer reassurance, and create a calm space where your loved one feels safe and peaceful. In these last weeks or months, the greatest gift isn't more medical treatment. It's comfort, dignity, and knowing they are not alone. As we come to the end of this video, let's take a quiet moment to reflect on what we've talked about. Significant weight loss, deep fatigue, changes in thinking, frequent infections, and shifts in breathing and circulation. These 5 signs often appear during the year before an elderly person passes away. They may not all happen at once, and at first, they can be easy to miss. But when you begin to notice them, it means the body is preparing for its final journey. For many families, accepting these changes is very difficult. It's natural to want to fight them, to encourage your loved one to eat more, move more, or push through tiredness. But sometimes, the kindest thing you can do is listen to what their body is telling you. Instead of trying to stop what is coming, focus on making the time left peaceful, comfortable, and full of meaning. Understanding these signs isn't about fearing the end. It's about being ready for it. When you recognize these changes early, you can give better care, make important decisions with calm, and help your loved ones spend their final months surrounded by love and dignity. This time is for cherishing moments, sharing memories, and letting them know they are deeply valued and never alone. If you see these signs in someone close to you, take a deep breath and remember, you are not alone. Many families have walked this path before. It's never easy, but knowing what to expect can help you find strength, patience, and peace. Thank you so much for watching today. We'd love to hear from you. Please leave a comment below sharing one thing you learned and how you plan to use it. Your thoughts mean a lot to us and encourage us to keep creating helpful content. If you found this video useful, please like, subscribe, and share. Your support helps us continue making videos that inform and inspire. Thanks again for being here. We look forward to seeing you in the next video.